Welcome back, all of you. Moving to our next topic, use of aids and processes in old age. So, commonly in old age, we can see hearing aids as well as dentures are very common. So, prosthesis. Prosthesis is an artificial device used to replace a missing body part, such as a limb, tooth, eye, or heart valve. Prosthesis refers to the replacement of a missing body part with such a device. In medicine, prosthesis is an artificial extension that replaces a missing body part. So it is a part of the field of biomechatronics. That means the electrical and mechanical field is integrated with biology. So it is a biomechatronics, the science of fusing mechanical devices with human muscle, skeleton, and nervous systems to assist or enhance motor control lost by trauma, disease, as well as defect. So processes are typically used to replace parts which is lost by the injury, that is traumatic injury, or missing from birth itself, congenital problems or defects, or to supplement any defective body parts. So that is about prosthesis. So inside the body, artificial heart valves are in common use. That is a prosthesis. So similarly, artificial hearts and lungs are also available, but the usage is less common. So the technology will develop and it will replace the deceased heart as well as lungs with artificial hearts and lungs going on. The clinical trials are still going on. So other medical devices and aids that can be considered prosthetics include artificial eye. So in case of complete enucleation of the eyes, we can we can place an artificial eye which is not having the power of eye. Okay. Palatal obturator. Palatal obturator is similarly a kind of denture, but not completely replacing the teeth, but instead it will replace the damaged palate. So likewise, there is gastric bands and dentures. So here you can see a gastric band. The gastric bands are commonly used to control obesity. So treatment of obesity. So here what is happening is it will tighten the upper part of the stomach. So the person is only able to take a small amount of food. If even after taking a small amount of food, it will the feel is like fullness. So in that case, to reduce the obesity, we can use this. And here you can see obturator, palatal obturator. So these all things are not our topic. Our topic is dental prosthesis. See the smiling face. Dental prosthesis is an artificial appliance which is used as a substitution for the replacement of teeth. In certain condition of missing teeth, the empty space between teeth can lead to teeth shift to compensate for the space. So dental prosthesis is one of the common prostheses used by our old age persons. So dentures are prosthetic devices constructed to replace missing teeth and which are supported by surrounding soft and hard tissues of the oral cavity. Conventional dentures are removable. However, there are many different types of dentures. There are two main categories depending on whether they are used to replace the missing teeth on the mandibular arc or the maxillary arc. Upper part as well as lower part, that are the main two categories. So here you can see the upper part as well as lower part. There are partial dentures, complete dentures, as well as implant supported dentures. So implant supported dentures placement are less done in old age persons. Why? Because there will be invasive procedures. So it can again leads to infection as well as the healing power will be decreased because the immunity is also decreased in the old age persons. So commonly used is complete as well as partial dentures. Complete is the one most of the old age persons used. Advantages. So dentures can help patients in a number of ways. Mastication is one of the advantage. Chewing ability is improved by replacing edentulous areas with denture teeth. Aesthetics, that means mainly appearance. The presence of teeth provide a natural facial appearance, and wearing a denture to replace missing teeth provides support for the lips and cheeks. So mastications, uh, so chewing ability is improved by replacing edentulous areas. Edentulous areas, the areas which is having lack of teeth. So in that case, chewing ability is being replaced. Aesthetic means it will give a natural facial experience. Uh, why? Because it will support the lips as well as cheeks. Next is phonetics. So by replacing missing teeth, especially the anterior, patients are better able to speak by improving pronunciation of those words containing sibilants as well as fricatives. So sibilants as well as fricatives are words which is having s, ish, as well as z, all those alphabets. So sibilant sounds say, so, she, ash, chip, each, su, crazy, all those things. So it will be better to pronounce in a good way while replacing the lost teeth. So self-esteem. A patient feel better about themselves while wearing a denture. So these are the advantages. What are they? Mastication, aesthetics, phonetics, self-esteem. So types of dental prostheses that we can see in next video.